Hi everyone, welcome. Today is a good day and a pleasant day because we are here to interview Dr. Mohit, who has successfully scored the first rank in the pediatric emergency medicine. Dr. Mohit, can you introduce yourself and where did you do your UG, PG, and how did you develop this passion for pediatric emergency medicine?
Good afternoon, sir. Thank you very much for the. Sir, I'm Dr. Mohit Devendra Jaiswal. I did my undergraduation from Indira Gandhi Medical College, Nagpur. Then I did my residency in MD Pediatrics from AIMS Raipur. That started from 2022, and I have completed my residency in September 2025, sir. Currently, I'm working as a senior resident in CAFE Delhi, sir.
Okay, how did you develop this interest towards pediatric emergency medicine?
Uh, Actually, sir, in AIMS Raipur, there is currently a DM program running in the pediatric emergency, and we were posted for 6 months in the pediatric emergency. That time, we saw that the initial 1 hour, that is the golden hour of management, is very important in the outcome of the patient. So from there, I got interested in pediatric emergency. That this initial 1 hour, we have to be very thorough regarding the physiology, the pathophysiology of the condition, and the initial golden management that we require in the form of A, B, C, D, E. That that is very important. So from there, I got interested in pediatric emergency, and our seniors also, like Dilip sir, Murugan sir. Uh, from them, I got the inspiration. Ki I can also do the pediatric emergency.
Oh, great. It's a very unique program of DM pediatric emergency medicine, and off late, the spectrum of this program is very huge. It covers a very wider area of governments and institutions, and then private institutions. The scope is increasing far more because we are even like I'm working in a corporate group of hospitals, and we
Yes,
also see the need for an exclusive pediatric emergency physician who can handle and structure the emergency rather than just managing the patient. We need a structured emergency to be run in terms of pediatrics. So I think this course is going to open a new arena in the future.
yes, sir.
And uh, okay, so now coming to how did you prepare for this particular course? Like you want to get it. I know that pediatrics occupies 50% of whatever you prepare. So how did you prepare exclusively for pediatric emergency for this particular program? Like what all did you do?
Actually, first, I asked my seniors ki what is the percentage of the questions in the general pediatrics versus the emergency. They told ki 60-40 is the ratio. 60% questions are on the emergency part and 40% questions are on the general pediatrics part. I was lucky enough. I've completed my residency, and in the next 2 months, the exam was there. So I had the fresh knowledge of the general pediatrics. So I was focused enough. I I note that this part only I have to focus on. The initial first 10 chapters of the Ghai, that is very important. So I read that in detail from Ghai as well as from the Nelson and from the Marrow aspect. The 47 videos there are in the general pediatrics section, which were very helpful. They were precise, concise. Uh, One thing is that in the textbook, we have all the details, but uh, what we require to crack a MCQ, that is given best in the Marrow. So that I thought that was helpful. कि all the मतलब कि इतना सारा नॉलेज था बट स्पेसिफिक क्या चाहिए वो that was given in the Marrow. Then the second
Okay.
part for the emergency part, the standard textbook for the pediatric emergency is the Fleischer textbook. As the time was 2 to 3 months, I could not read that in detail. So the important topics, that is the primary survey, the secondary survey, the ATLS management, that I covered from the Fleischer. Rest all emergencies I covered from the AIMS PICO protocol and your videos, sir. The critical care section, that 31 videos helped me a lot. Some parts were some questions were directly from the videos only, the difficult airway
Okay.
part and the AKI part also, the flowchart were given from that one question came. So that 31 videos were very helpful, sir.
Yeah,
But
great.
not exclusive emergency section, but from the critical care part, that was very helpful for me, sir.
We did do a video for emergency section. So I think what would you suggest us to add in those, apart from those 31 videos, like
Yes.
being an emergency physician, what else you feel like this importance should be given in these, like we need videos on these particular aspects also.
Uh, yes,
Regarding
first
example of that you feel like they are necessary.
So first was the ATLS. The ATLS specific to the pediatrics are the newer guidelines that came recently. Then one is the cardiopulmonary resuscitation. That is very important. They have asked two, three questions in this exam also.
No.
So post cardiac care management also they have asked. Then third is the rapid rapid sequence intubation, modified RSI, then delayed sequence intubation. That are the hot topics for the pediatric emergency. Then anaphylaxis management also, sir. They are very keen in asking the anaphylaxis management. Then the burns, cold injuries, drowning, and the high altitude sickness. And the most important topic in the pediatric emergency is the poisoning section, sir. So how to approach a poisoning, and they are more fond of asking the paracetamol poisoning, the
Okay.
uh, aspirin poisoning, then the bites also, the snake bites and the scorpion
Mm.
bites. This they are very fond of. But
Okay.
diabetic ketoacidosis, it was covered in the endocrine video section, so that I did from there. But these are the parts that were not there in the critical section, but important is preparing for a pediatric emergency.
Mm. Good. So, like, we will try to add on these videos in the coming edition
Yes,
because
sir.
we focus only on critical care. Now, emergency also is coming up as an important field and
Yes.
important aspect. So, we'll try to put a focus on these videos. And what are your plans? Like, your which institute? Like, AIMS Raipur is the only institute running this program, right?
Yes, sir. Yes, sir.
So, you would be joining in AIMS Raipur, continuing there.
Yes, sir. I will be joining AIMS Raipur. Uh, Mostly, I'm planning to settle in the Raipur only. I like the city, sir. So
Great, great. All the best. All the best, Dr. Mohit. It was nice knowing you. I have been to Raipur a year back. Dr. Atul was my senior and he was also my mentor. So
yes, sir.
I was there for the ventilation workshop. And it is a very nice city, as you said. And we will try to add up on these videos. And I'm very glad that 31 videos that we did in critical care helped actually in pediatric emergency. So now
Yes, sir.
let's for pediatric emergency also. And one more
Yes, sir.
thing that I would like to ask you is, suppose if, like, for example, the interview aspect that we didn't discuss, we discussed only the theory aspect. During the interview aspect for your pediatric emergency, like how did it go, and what were their focus upon?
In the interview, sir, whatever topics I told, that topics only they are focused. They have asked six questions on that. That was in the OSCE format. So main they wanted to know how we'll approach the case in the emergency section. So they've given a central India scenario of sickle cell scenario was there. And the complication related to sickle cell, how will tackle in the emergency basis that they have asked. Then
Okay.
second also pulseless VT was there. So they
Okay.
wanted to know how will approach in the ABC format or the new guidelines regarding the single approacher or both approaches. Uh, they wanted to know how will approach the case.
Okay.
Interviews are I'm not uh, matlab, I know most of the answers, but I could not express myself. So more of anxiety, and we have to keep the head calm during the interview. That was the main part. But most of the answers I could, मतलब most of the questions I could answer. ऐसे नहीं था कि कोई भी क्वेश्चन they have asked out of the box. They were asking the simple questions only. They just wanted to know how will case.
Okay. So basically, it is more practical oriented
Yes, sir.
interview. Like it's more of case based scenarios, and they wanted to know how you approach the case rather
Yes.
than a single worded questions and other kind of a thing. And it
No,
was
yes,
not theoretical, like what is the like percentage, facts, nothing like that, right?
no, that were the next question if we were able to answer. First, the sickle cell part was there in my case. Then the diagnosis was ACS. Then
Okay.
they asked the next question. They what are the recent updates regarding the fluid management? Initially, we
Okay.
used to give the 150 times the maintenance fluid, but in the trials, so I answered. But that were the next question. If we are able to answer the two, three initial questions, then they were asking in detail about the. matlab, After that, they were asking.
Okay. So fine. So we need to be prepared for both. But anyway, most it is the practical questions that there will be. How long did the interview go?
Sir, actually, 15 minutes, 15 to 20 minutes in the. Yes, sir.
Oh, that's a long interview, relatively.
Yes, sir.
So you should keep your head sharp. Okay, okay,
Ye-
Dr. Mohit, it was nice talking to you and congratulations on opting
Yes,
for pediatric emergency medicine DM. And I hope that I come back to Raipur and I see you
yes,
also
sir.
back to Raipur.
I- Yes, sir. Sir, one thing I want to tell. Sir came last year in the ventilation workshop. I've listened to your class, sir. That time only I was very inspired to take Marrow, and our seniors told ki you are the faculty in Marrow. So
Okay,
I was yes, sir. You have explained the respiratory physiology in a way that we could not read in the 3 years. Then we could integrate that in the practical approach also, sir. So
okay.
your teaching ways,
Thanks a lot.
I like it. Yes, sir.
Thanks a lot, Mohit. I hope I will add on to the other sections that you had mentioned
Yes, sir.
and the coming revision that we are preparing currently.
Yes,
I hope it is
yes.
going to be good. Yeah. Thank you.